Well, this is Mr. Root. He's 4 weeks out now from a reverse shoulder, from a precision shoulder, and he's doing great. Tell us a little bit about your pain after the surgery.
The pain has almost been non-existent. I think I did the right things when I was supposed to, and the pain is it just hasn't been there.
That's great. And so then we're 4 weeks out now, so we're going to be able to get rid of our sling and start doing normal daily activities. Why don't you show them the motion that you have in your shoulder?
Okay.
Go ahead and lift it up for me. So he's got fantastic elevation. Come on down for me. It's awesome. And then he can rotate out here. I mean, just really, really well. And then this one, most patients lose a little bit, but you've actually got pretty good internal rotation as well. His incision's healing nicely. He's got a little incision here in the front of his shoulder. And overall, he's doing extremely well, so we're really happy for him. So at this point, like I said, he'll start doing normal daily activities, and then hopefully back to things like golf or tennis here in around 4 or 5 months.
Sounds like a winner to me.
Good. Here is his preoperative x-ray where he had a previous rotator cuff repair, and unfortunately that had failed. And obviously some arthritic changes here. And then this is his x-ray after surgery. He does have a pacemaker here, so that's obviously obscuring some of the detail, but his implants look great. I look forward to discussing the precision shoulder with you and how we can reduce your pain and get you back to the activities that are so important to your quality of life.